Well, with measles outbreak still spreading across the country and California, earlier this morning we talked with a local dermatologist about the early warning signs. Tonight we continue that discussion with some important precautions we can all take. Please welcome Dr. Melanie Palm from the Art of Skin. Good morning, Doctor.
Brooke. Good morning to you.
All right, so we talked a little bit about, and I want to recap on that, what some of the warning signs are with measles.
So there's a prodrome, what happens beforehand, and it's a cough, runny nose, and irritated eyes, but a high fever too as well, up to about 104, 105 degrees. But then the rash starts about 4 to 5 days after all of this other stuff occurs. And it really is a sort of red speckles. It starts usually at the top of our head and sort of works our way down towards our toes. And the big thing is you are contagious 4 days before the rash starts and 4 days afterwards. So that's why we're having problems with containment with this recent outbreak.
So what are some of the precautions, the real big precautions we can take?
Yeah, so it's spread through what's called respiratory droplets. So coughing and sneezing makes it airborne, and it can live on surfaces for a couple of hours. So because it can either be inhaled or go through some of our mucous membranes, being careful about touching your eyes, touching your nose. Being careful if you're unimmunized, going into large crowds of people, especially if it's a bigger concern, areas, amusement parks where it started, large congregations of people, I think you need to be on a little bit of heightened awareness.
And there's been that debate recently over whether or not immunizing your children is safe and does it lead to autism. What's your quick thought on that?
It's absolutely safe. The United States president was on the other week talking about really, getting people immunized. So we've disproven that, and it's so important at 12 to 15 months to get your child vaccinated, and again at 4 to 6. It's 93% effective at immunization with that one dose and 97% with the second.
Now, if you saw those warning signs in someone in your family or yourself, you don't want to go running into an emergency room. Is that correct?
Yeah, I would call your doctor. It needs to be reported to the health department within 24 hours because there is this 8-day of sort of contagion. You really need to be careful about getting on public transportation, who you're exposing yourself to, because if you're walking into an ER without them knowing, you have the potential of spreading it to others.
And I would imagine it's important to just be aware of your surroundings as well.
Yeah, so if you see somebody with a sneeze or a cough and you know you're at higher risk, if you're immunized, if you're less than 5 and haven't been immunized, or if you're greater than 20 and an adult, you really need to sort of be on the lookout. If you see somebody with a peculiar rash, if you see these injected sort of red eyeballs, somebody that's sneezing has a cough, it's somebody you need to be careful about.
And are younger children and older adults more at risk?
They are. So people that have higher what we call morbidity, side effects, and mortality, risk of death, are in these age groups and the immunocompromised. So you can get pneumonia, you can get swelling of the brain called encephalitis, you can get other various sequelae. About 1 to 2 per 1,000 children that get measles actually die.
Well, certainly some very important precautions to take, and we thank you for sharing that with us here this morning and again tonight.
Thank you, Brooke.
All right. Thank you, Dr. Palm. All right. We'll send it back to you over at the desk, Derek.